The key is to identify these cancers early so we can increase the survival. Now, in the past, maybe 20, 30 years ago, most of the lumps were found by women themselves doing a self-breast exam, and we cannot stress the importance of continuing to do so. However, with the adjunct of new modalities such as digital mammography, breast ultrasounds, and breast MRs, we're actually finding more and more non-palpable lesions, both benign and malignant. And at this time, the only way we can tell whether or not a tissue is truly malignant is through biopsies, whether it be stereotactic biopsies or surgical biopsies. So every day as clinicians, we are looking for another method, a less invasive method to try to identify these tumors that are malignant. And one of the very promising new technology is called elastography. And how we use this in breast is that when you apply pressure to normal breast tissue, it becomes very compressible, and if you will, you can demonstrate, let's say this is a normal breast tissue, you can tell how pliable when you apply pressure with your hand, it actually conforms and changes shapes. Whereas a malignant cell, if you have a tumor, is more like this marble, which is very firm. And when you actually apply pressure onto it, it does not give. So these are two different properties of tissue stiffness that is seen in normal and malignant tissue. There are many studies out there that are studying elastography, and it looks very promising. And comparing to tissue biopsy, some of the studies show up to a 98% accuracy in determining malignancy in certain tumors. So although we're not completely there yet, I think further studies are still underway, and it looks like a very promising tool to help us become more and more, or less and less invasive.